من قاعدتاً عادت دارم که پرزنتیشن های خودم رو فقط از نگاه موتیویشن تو تمامی کنگره ها به صورت انگلیسی ارائه میکنم. علتش هم فقط به خاطر موتیویت کردن دانشجویانی که تو مقطع بچلر یا دوره مستر و یا پی‌اچ‌دی هستن و یا تمامی آدینس که ما همیشه یعنی بعضا عادت داریم از یک سری سخنرانایی که مثلا از پاکستان یا جای دیگه میاریم از اونا بهره ببریم. این نگاه ایندیویدوال و شخصی منه که این تو بعضی از کنگره ها مثلا کنگره های نشنال یه مقدارم روی این قسمت بحث بکنیم. بنابراین جسارتا من به صورت انگلیسی ارائه میکنم. In the name of God, the most compassionate and the most merciful. The title of my presentation is Complementary Therapy in Cancer. I am so thankful of all of you for taking part in this valuable Congress. I am so thankful of Dr. Hadi as the scientific secretary of this valuable National Congress in the realm of nutrition. I am so thankful of Ms. Salehi and Dr. Eslahi, who is PhD student, Mr. Eslahi, PhD student in Shiraz University of Medical Sciences. He accepted in current year. I want to speak about introduction, supplement in cancer fighting food. About classification, as you know, there are two kind of cancer, malignant. There are two kind of tumor, malignant tumor and benign tumor. As you know, there are some causes for cancer. In these days, in the globe, as Dr. Ahmadi mentioned to this issue very well, a lot of people suffer of cancer, especially colorectal cancer. So it is important to think to put some congress in about this issue, about nutrition in cancer. There are some causes for cancer, like stress, that fortunately or unfortunately in the Iran, a lot of people suffer of a lot of stress and anxiety for the reason of inflammation that are so bad in these days in our country. Genetic is another cause, environmental factor, and some toxin. As I mentioned previously, the prevalence of cancer in these days in the globe is rising badly. The most common cancer are breast cancer in between women and prostate cancer between men. About mortality rate, comparable to other mortalities that is related to some diseases like heart disease, coronary heart disease, diabetes, and so on. The second one, in mortality point of view, is related to cancer. About a supplement, it is so important to know about definition of supplement. What is supplement? What is the main role of supplement in prevention and treatment of some disease, especially cancer, mineral element. We want to speak about this matter. One of element that is so effective for cancer in preventive and treatment point of view is antioxidant. There are two kinds of antioxidant, enzymatic and non-enzymatic. Superoxide dismutase, glutathione peroxidase, and catalase are as enzymatic, and some vitamins and some mineral are so good for are so good as antioxidant. What's the role of antioxidant? Encoding detoxification enzymes, decreasing secondary side effect, decrease side effect of some disease, and it is so important for treatment. A lot of antioxidant can block the poisoning of some material, for example, cisplatin, that it is used for treatments and it is so used in chemotherapy. And antioxidant is so important for decreasing oxidative stress. As non-enzymatic, we can mention two gala, catechin, galat, curcumin, and resveratrol. All of them can decrease hydrogen peroxide level. If you can, in face with some mistake about my presentation, it is related to my eyes. The QL, that is stand for health-related quality of life. Another complement that we can prescribe for the person who suffer of cancer is alpha-lipoic acid. It can block growth of cancer cells. ALA can decrease proliferation of some cancer cells like prostate, breast, and bladder, and it can decrease the proliferation and adhesion and invasion of some cancers. About water-soluble nutrient, one of them is vitamin C. Vitamin C is so important to recommend after some surgery, or for the person who suffers of some cancer. As you know, it has antioxidant effect for production and for production of collagen. It is so good, and it controls the growth of cancer cells. I want to mention some of nutrients like vitamin and mineral as a brief, because we have time limitation. Vitamin C, the result of some research has shown that prescription of vitamin C can decrease prostate and colorectal cancer. Another vitamin we can mention to vitamin B6. As you know, vitamin B6 has DNA repairing function. It can decrease nausea, and it has antitoxicity agent. And another with vitamins, for example, vitamin B12 and so on. About vitamin A, as you know, vitamin A has a key role in the synthesis in gene expression. So the result of some research has shown that decreasing of vitamin A can lead to the increasing of some cancer. So prescription of vitamin A is so good. This is another study that is related to prescription of vitamin D. It can decrease breast, cervical, and other cancers between women. About vitamin D, as you know, vitamin D has a key role in gene expression, about the regulation of gene expression, and recommendation of vitamin D can decrease the cancer growth. And another, this is another study related to vitamin D, that the outcome of a study has shown that the person who their vitamin D is less than or equal 20 nanogram in ml, the rate of melanoma is increased also. Vitamin E, as you know, it is the strongest antioxidant, so it is so good to prescribe it for the person who suffer of some kind of cancer, because we don't have enough time. I don't mention to the function of it related to cancer deeply. Okay. The result of one study that was done in 2023 has shown that the prescription of vitamin E can decrease the recurrence and survival of cancer cells. Vitamin K is another vitamin. It can decrease growth of cancer cells also. Another nutrient that is so important to prescribe for the person who suffers of cancer is selenium. It can increase apoptosis of tumor cells. It can increase glutathione peroxidase. It is so important for DNA repairment. Selenium. Magnesium, it can decrease neurotoxicity and decrease pancreatic cancer. This is another study for the positive effect of magnesium on the people who suffer of cancer. Manganese, as manganese superoxide dismutase, it has antioxidant defense function. It is so important for increasing immune response. Zinc, as you know, is another element that is so important for synthesis of DNA, and it can decrease occurrence, onset, severity of some mucositis, and it can decrease head and neck cancer. There is a study that was done in 2024 that has shown that zinc has a positive effect about prostate cancer, protective role in prostate cancer. Potassium, as you know, it is good for fluid balance, and for fluid balance we can prescribe it after surgery for the person who have gone to colorectal cancer and so on. The result of some study has shown that decreasing of potassium can increase some cancers. And fiber, as you know, fiber can increase peristaltic move, and time it can decrease the contact of carcinogens with the epithelial cell. So prescription of fiber in preventive and the treatment point of view is so good. So fiber, we can recommend fiber for both of them, for preventive and for treatment of some cancers. Again, I'm so apologize because I had a lot of mistake, and my accent is not so good because I can't change it. I'm a Zabolian people, and the Zabolian people can change their accent. Thank you of all of you. If you have any question, I'm completely ready to be at your service.